Hello and welcome back to Talk of the Town. If you are a parent out there, this might be a question on your mind. We're talking a little bit about children's dentistry, and as soon as those first couple teeth pop in, you start wondering, should I be taking my kid to the dentist? We'll answer that question for you. Right now I'm joined by Dr. Cecilia Thompson with Children's Dental Center. Thanks for being with us.
Oh, thanks for having me.
So I'm glad to chat with you. You've got 3 Madison area locations, so there might be one near you. And let's talk a little bit about that first dental visit. What age do we start?
Yes, the American Academy of Pediatric Dentistry recommends age 1 for that first appointment, and the reason being we want to establish a dental home. So a place where your child comes for regular dental appointments, a place where you can call if you have questions, and in the unfortunate case of an emergency, you have a resource to call or visit.
Well, that's a really good point. If there is something funny that happens when they're playing or falling, which they do a lot in those early years, you've got an office and a place that you can kind of call home for your dental needs.
Correct. We have someone on call 24 hours, so nights and weekends, and you just call the office and it connects you to whoever's on call and we help you with whatever you need.
Okay, let's talk about that first appointment because parents out there of a 1-year-old know how challenging it might be to try and brush those teeth. So what in the heck happens at the dentist's office at age 1?
Yes, so memory starts at 6 months. So age 1 is a great age because the child will start to remember the positive experiences they have. And that first appointment is really laying the groundwork. It's laying the groundwork for positive experiences at the dentist that the child will carry with them through their entire life. And so we spend a lot of time talking with parents about prevention. We spend a lot of time with the child, trying to take cues from the child as to how much they really want to do that day. So some 1-year-olds will lay in the chair and let us use whatever we need to do, and some like to sit in mom or dad's lap, and that's okay. We just make sure it's a comfortable, positive experience for everyone.
Yeah, and even if you may have one that's a little bit more challenging or less willing to sort of just lay down and let you look, at least it's setting sort of the groundwork. So it's a first experience. They get to go, they get sort of used to the space, things like that, and you can maybe give the parents some pointers too.
Correct.
Yeah,
yes.
That's really important. Let's talk a little bit about preparing them for the first dental visit so that we can have the more positive experience.
Yes.
Because can you prepare a 1-year-old for a dental visit? How do you do that?
Yeah, so at any age, I think kids are pretty in tune to media. So watching videos, there's books geared towards the first dental appointment, YouTube videos of other kids going to the dentist, having good experiences there helps a lot. Kids also take cues from parents. So some parents are nervous going to the dentist, and that's okay, but working really hard to try to stay very positive and excited about the dental visit, and try not to pass your nervousness on to your child is really helpful.
That's such a good tip because, yeah, you're right, that energy definitely transfers. They feel your fear.
Yes, for
yeah.
sure.
Let's talk a little bit about helping parents prevent cavities in those early years. Can be a challenge. What do you do?
Yeah, so cavities start for 3 reasons, and one of the reasons is bacteria, and everyone has bacteria in your mouth, and it's hard to control that. So we've tried to focus on the 2 areas we can control, which is diet and oral hygiene. So for diet, trying to avoid those sugary, acidic drinks like lemonade, juice, soda, Gatorade, just that high sugar content. Kids don't need that, and it's not good for their teeth. And then trying to help them brush. And at each age, there's different challenges with that, so we definitely talk about that a lot during appointments. But the most important thing is to brush at night with parent help. And so a lot of kids want to do it themselves, and that's fine, but at the end of the day, an adult should make sure the toothbrush touches every tooth so that when kids go to sleep, they're going to bed with clean teeth and the bacteria don't have anything to work with to try to make cavities.
Yeah, and I actually read somewhere that you should be helping them longer than you think, sometimes even to like age 5 or 6,
yes,
because they're not really capable of getting a good brush themselves.
Exactly. The manual dexterity changes, as well as new teeth coming in that are farther back, and kids don't always want to put the toothbrush back there, so trying to help them with that is really important.
Really quick, we gotta head to break, but I think this is an important quick question about general dentistry versus pediatric pediatric dentistry. What's the difference there?
Yes, so a general dentist and a pediatric dentist complete dental school, approximately 4 years. And a general dentist is very equipped to treat children. A pediatric dentist does do continuing education in a residency program, which prepares them to do conscious sedations in office, to treat kids under general anesthesia at the hospital. And so that's just a big difference, but they work together. And so the general dentist may opt to refer more complex cases to a pediatric specialist, but in the end, they all work together for what's best for the kid.
So a pediatric dentist just has that extra continued education and specialty. I think that's important. Thank you for sharing that with us.
You're welcome.
This is Dr. Cecilia Thompson with Children's Dental Center, in 3 Madison area locations. Find one near you and find Talk of the Town after the break. Stay with us.